I'm Asher from the Environmental Media Association. This is going to be our very first impact virtual Zoom, I guess. I guess that's what we're calling it. We don't really have a name for it yet, but we're working with Harvard Sea Change. I'm so happy about that. And today we have Dr. Aaron Bernstein, and we have Emma board member Eric Christian Olsen. Also on this Zoom are Sky Flanagan and Anna Miller from Harvard Sea Change. I'm not going to say anything else other than thank you so much for getting together and doing this. This is going to be super informative, and we hope that you guys enjoy this first of what will be many conversations that we have with incredible folks. I'm putting myself on mute. You guys talk. Bye.
Great work. I love that it's the first one, which really means that it can go completely sideways and there's nothing to compare it to. It's going to be fantastic. My name is Eric Christian Olsen. I'm here representing the Environmental Media Association. I'm on the parental board. And I think that this is a really exciting conversation to have, because I think that we are in unprecedented times, not only as a country, but as a species. And I think so much of the decision-making and the policy being handled down from leadership is based on economic data versus what I would call the human element. And so when striving to figure out a solution and a path forward for the human element, we go back to what we love at the Environmental Media Association, which is the science, the research, and the data. And we talk to the smartest people in the rooms, which is the perfect segue to have a conversation with Dr. Aaron Bernstein. He's a Boston pediatrician. He's director of the Center for Climate Health and Global Environment at Harvard T.C. Chang School, or the Public Health Harvard Sea Change. Ari has spent his entire career studying the latest evidence on the connections between the biosphere, climate change, and disease emergence. He's the co-author of the first book to examine the full range of potential threats that diminished biodiversity poses to human health. But like all storytelling, we need to know who's guiding us on this path. And I think that it's important for me to understand as a father that he is also a father, taking care of two kids. And can you kind of walk us through, just to start off, what your home life is like right now during this quarantine time with two kids?
Well, it's a real pleasure to be with you, Eric. This is going to be fun, I can tell. So, what's it like at home? I mean, we've got a lot of buckets of paint. Then that's not just for the kids to play with, but it's to like paint over the walls that have been covered in paint. Rules are sort of a thing of the past. The rules, I think the adage that rules are meant to be broken is definitely happening in our room. Our garage is no longer the purview of, actually we never use it. We don't have a car in our garage, so it's now become the clubhouse, and that's pretty sweet. But yeah, I mean, it's a day-to-day adventure. It's wonderfully exhausting in the sense that, you know, I actually am not a particularly good first grade teacher, as it turns out. But you know, I try. But you know, at the end of the day, and especially in line of what I have to do for a day job, we're enormously fortunate in the context of what's been going on, and
Right.
And it's hard not to see that every day,
Right.
because there are a lot of folks right now who, you know, you're I'm sure extremely well aware of, who this you know, what's going on is just immensely difficult.
Right. But and I think that's the empathy that we're looking for, which is the balance between understanding that, you know, these are individual struggles, but this is struggles as a community, this is struggles as a nation, and what we'll get into obviously is the upstream solutions for us, as you know, this is a global crisis. Let's go back micro first. Can you talk a little bit, as a pediatrician, you're working in the hospitals during this pandemic. What are you seeing right now in Boston with your patients and with the kids?
Yeah, no, you know, the blessing of this disaster is that it's easy on our children, relatively speaking. I mean, it's bad enough to watch my friends and colleagues get sick, but, you know, looking at kids getting sick with this would be a whole nother league of difficulty. And thankfully, we're not seeing much of that. Obviously, there are kids who are getting sick. But, you know, just to the point you made, Eric, when I was in the hospital a few weeks ago, and and this is just at the outset in Boston, and I was dressing up in what I like to call my alien suit. That's like the best costume I get to wear on a regular basis.
Right. I've worn it. It's not comfortable. It's very hot.
It is. It's like a great. Actually, we should look into that. I'd like get a winter coat made out of that. But you know, I went into this kid's room and dressed up as an alien, and it's hard enough, to make a relationship with a kid whom you've never met when you look somewhat normal, and then when you look like an alien, it's a little harder. And somehow we managed to figure out a way to laugh together. But as I was examining that kid, and we were concerned that the kid might have the virus. The thought that just stuck in my head is like, in touching this kid, and this sounds crazy. I know this sounds crazy, but this is really what I was thinking. Is I'm touching a bat that lives somewhere in Asia.
Yep.
Because the virus that could be infecting this kid has traveled across the world, and not just among a bunch of people, but from other animals.
Right.
And it's like in that crystallizing moment, we realize, number one, how we can do everything we can to keep ourselves healthy, and that's really important. We can listen to all the crazy things that people like me tell children, for instance, like eat your vegetables, make sure you exercise. But our health really matters in the context of the health of the people in our communities and in the world, and the welfare of the other creatures we share the planet with.
Right.
And it was just this amazing moment where, I'm here taking care of this kid, and immediately it occurs to me that I'm going to do whatever I can, but ultimately, if we're going to do something about this, we have to recognize this other part of the puzzle.
Right. Well, we're going to get into that, because I think one of the things that we talk about conservation, we talk about the animal and human interface, and what that means from a conservation standpoint. But also I wanted to talk about, because you had mentioned this before, which is that can you articulate at all the cohort effects of the pandemics and how that shapes worldview for kids and patients?
Yeah, I mean, the closest example we have is like polio. Like my grandparents and parents would talk about like the polio summers, right, where no one could go to the pool, and no one, and it really shapes how people think about, life. And I expect the same thing's going to happen here. I mean, we're all going to look back at this period and be like, wow, like pretty much no one went to work for like months.
Right.
And 22 million people may have lost their jobs. And we still got a long way to get out of this tunnel, but it's going to really shape things. And seeing what we see now, one of the things I really try and talk about with my kids, although I will be the first to admit this is not the easiest conversation with a 6-year-old and a 4-year-old, but
right.
Honestly, we're not going to school, we're not seeing our friends, we're doing all this stuff, which they don't really, at its fullest, I think, grasp, but they're doing it. And they're not doing it for themselves. I mean, as I said, fortunately, kids, especially kids like mine who are generally healthy, this virus is probably not going to be a major deal for them. They're doing it because of the people around them. We have a downstairs neighbor who is older. We have people on our block who have medical problems. We live in a city with a substantial homeless population. The reality is that by preventing ourselves from getting infected, we're protecting other people. And that is such I mean, in the midst of this mess, I'm trying to find some silver lining here. If we can have kids come through this with recognition that we're doing things differently because it is important for us. That's not to say it isn't, but really it's important for the people we share our community with, and especially for folks who aren't as fortunate as us. That's a pretty amazing opportunity from a learning standpoint. I'm not sure I've gotten there with my own family, but we're trying.
No, but that's beautiful, and that's the juggle, right? Is that there's catastrophic news on a macro scale, and then there's the opportunities, which we refer to as teachable moments, which is like, what is your role as an individual in a larger community? And I think that kind of philosophy will lead to the larger conversation we have today, which is about the environment and conservation and what it means to play that role in a larger piece of the world. But I know exactly what you're saying, and I'm on a show where we have crime scene investigations. And so we have boxes and boxes of gloves. And so I got my son and daughter and I said, we're going to go get all those boxes from the prop department, and we're going to distribute those on the block. And we explained how, exactly what you said, that fortunately, because it'd be such a different virus if it affected kids as much as it does people, above 65. I was like, there's a lot of people on our block that have, that are in the set that this can be really dangerous for them. So we're going to package these gloves up. We're going to put gloves on, put masks on. We're going to fill Ziploc bags with all these gloves, and we're going to deliver them to the houses up and down the block. And I think their understanding of what their role is in this became crystallized in those moments. I think it's exactly what you're talking about, which is, you know, there is no silver lining, but there are definitely moments in which we get to discuss about what our values are as people and as hopefully as a country. But let's transition into what the specialty that you're, you know, at the top of the food chain on, which is the connection between COVID-19 pandemics and climate change. And I don't know how you want to macro into that, and then we'll just get into the nitty gritty.
Yeah. You know, here's the amazing thing, which is, you know, whether we're talking about the very origins of this, like how this virus got from a bat into a person, or the very sort of tail end of it, which is how we wind up protecting ourselves, it all has to do in some way with climate. And, you know, that's not trying to fit a square peg into a round hole. And that happens because climate and climate change is so fundamental to our ability to be healthy. So let me just touch those two ends and we can talk about the middle.
Great.
You know, we don't have definitive evidence that the virus is in a bat, but it's a coronavirus. And as much as we know about coronaviruses, they're all in bats. And, you know, we've had other coronaviruses like SARS and MERS came into people through bats. Well, we know that bats, and the best example of this is actually Ebola, which was on people's mind not so long ago, have been losing their homes. Bats around the world live in forests. Forests, you know, get knocked down. Bats have to go somewhere else. And one of the first places they might go is near people because we have food. And so whether it's the ongoing Ebola epidemics in West Africa or the outbreak of Nipah virus in the late 90s in Malaysia, there's evidence that by, you know, getting rid of forests, we're actually making bats come into more contact with people. I don't know that that happened with COVID, but, you know, one has to wonder. I want to make a clear point here, which is that doesn't mean we need to kill all the bats.
Right.
Because in fact, the bats are doing us a lot of favors.
Yep. Yeah.
And so the idea is we need to protect the bats to protect ourselves.
Right.
Which
deforestation, slash and burn agriculture. Yeah.
Yeah. So then on the downstream end, so like, what are we supposed to do? Like, what am I telling my children to do? Wash our hands. Well, what if you don't have water?
Right.
I mean, climate change, you know, in many parts of the world is really adding pressure on water supplies. I mean, we had places like, you know, Cape Town in South Africa or various cities in India in the past few years where they're like, we're done with water or worried about being done with availability of water. Part of that's because there are a lot of people using a lot of water, and part of it because we're seeing these ridiculous droughts. And so, you know, imagine now we have COVID in 30 years and these places that are water stressed are yet more water stressed in part because of climate. And that makes our problem not just worse for them, but worse for us, because of course viruses don't care about national borders.
Right.
And then, you know, in between. So, you know, we've known for a long time that air pollution is generally really bad. And we've even known that in instances with infections, respiratory infections, particularly for young children. And now we have specific evidence in the United States about the fact that people who've lived in places that have, on average, worst air pollution over many years, their lungs have been damaged so that they're more likely to die. And that's accounting for whether they were sick or not before they got infected and whether they have access to healthcare and other things that one would rightly expect would determine whether someone was going to get sicker with something like the coronavirus. And that frankly is concerning. One, because the air pollution is preventable. Two, because air pollution in the United States for the last 3 years has gotten worse for the first time in decades. And even as of yesterday, the federal government is starting to, in fact, I mean, there were some weeks ago, they did this in one form and now they're doing another form, essentially taking measures to make our air quality worse. And you know, I really honestly try and give people the benefit of the doubt who are making hard decisions about this kind of stuff, but I just don't see the attention to science and frankly, the attention to children in that light. So, and of course, that air pollution in the United States, just to be clear, is from burning fossil fuels. Fossil fuels are 70% of the carbon pollution problem, and they're the main reason that 1 in 5 children in this country have asthma that I have to take care of as a doctor. So whether we're talking about the origins, the ways we protect ourselves, or anything in the middle, the climate change is actually a part of this. And that means that climate solutions are kind of pandemic solutions.
Right. Yeah, those are the upstream solutions. I read that study that you guys did, and I can't remember. Was it 15% higher chance of death with particle materials that was only 1% higher?
Yeah, that's the gist of it. So this is the crazy part, right? So we measure the stuff in air pollution called particulate matter air pollution, right. And they're just particles. I mean, we don't really necessarily care where they came from. We measure them by their size. The size we tend to care most about these days is 2.5 microns. That's about a 20th the size of your hair, not mine, yours. And because it would be hard to and so we measure in the air, and in Boston, which has pretty good air quality, it might be 10. Is sort of an average day. In LA, it's actually usually worse. LA has, as you probably know, some not the best air quality in the country. So what the study showed was that for every unit increase, so like every microgram per meter cubed increase in air pollution, so that's like going from 10 to 11 on average and they looked at air pollution in these cities over like 15 years. That increased the death rate by 15%. So that means if you go up 2, it's twice as much. So, the other thing about this, Eric, is that we also know that, perhaps unsurprisingly, that not everybody's breathing the same air in this country. And it turns out that if you're Black or Latinx, you're breathing a lot more air pollution than if you're white. And so we see this data about African Americans in particular, dying more from this disease. And now we're wondering whether, in fact, the injustice of air pollution in our country that's been happening forever is now showing up in this particular disease, right? And the flip side of that is when we move away from fossil fuels, you not only get huge health benefits that extend beyond the pandemic. The air pollution has all kinds of bad effects, which we can talk about, but you actually right injustice. Which is a pretty amazing thing to do with one fell swoop there. And so the benefits of those actions get at the folks who've been harmed the most and, over the long haul.
Well, that's kind of a perfect transition to one of the things that I read that I thought was so radical in its approach. And you talked about looking at climate change as a matter of medical malpractice. Yeah. Which is that how do you tackle these big issues when so much of the world looks at this stuff from an economic standpoint and not a human standpoint? Can you talk about the philosophy of what that means and what that approach is?
Yeah, sure. I spend a lot of time with scientists and I spend a lot of time with doctors, and I'm sort of a mutt in that way because I'm not really fully either. and we're not the same species necessarily. So a scientist looks at a problem and says, okay, we're going to study this. We're doing an experiment. We're going to set up the famous one is, you have like one jelly bean that's over here, one jelly bean over there. We're going to pour like acid on this one and water on the other one and watch what happens. And if it turns out that has acid on it, melts, then we'll know the acid was, dangerous for the jelly bean. But then, if we get it wrong, we can do the experiment again. Right? We'll do it over. And frankly, science is really based upon the idea that lots of people do the same jelly bean experiment independently. And that if everybody gets the same answer, then we sort of expect that that's reality. Right. That's not the way I work as a doctor. If I have a baby in front of me who's less than a month old with a fever, I know from past experience that there's probably about a 10% chance that baby has a bacterial infection, which is most often like a urinary tract infection. Oh. And those are bad, but they're not as bad as like a bloodstream infection or an infection in the spinal cord, which it also could be. That's probably like 2% of the 10%.
Meningitis.
Yeah, meningitis. So 90% of the time, the fever's from something else, usually a virus, and the kid's going to be totally fine. But we don't do the experiment like the scientist does. And what we do is we, test the blood, we test the urine, and we test the spinal fluid to make sure there's no bacteria in it. But before we get the results, we're giving that child antibiotics because we know that inaction could end that child's life.
Yep.
And that we are not going to be able to clone that child back into existence. Yep. And that's sort of the exact problem we're dealing with climate change, is that we're looking at it right now too much as if we have Earth B. And that, if we get if we don't quite figure it out right, we'll just, we'll have acid on the jelly bean and it'll melt, but we'll have the next jelly bean to work on. Yep. And so, it would be one thing if the science weren't clear, right? It would be one thing if we had much less certainty about where we're looking at heading with carbon emissions, and also, of course, what that means for health. But we have much more scientific confidence there than in any number of other things. My favorite example is secondhand smoke. When secondhand smoke went the way of the dodo in the United States, when it became really taboo, there was not a lot of science there. It was frankly deemed gross by the public. And that's what, there was plenty of science that came showing that, it's really bad for people. But when it really started taking hold was at a time where the scientific consensus around that wasn't nearly as solid as what we have on climate change. And so that's what I mean by malpractice, which is if I were treating the Earth right now like it were my patient, and I were behaving the way we're behaving with climate, I would be sued and I would lose. So, and it's to your point about this economic reality is, economics is very much about people's observed behavior, like what we're willing to pay for stuff and how much we value stuff. But it sort of presumes that the value on the table, if we get it wrong, can be replaced, right? Like if Ford goes out of business, somebody else will start a new car company. Or, if company goes bank. That's not how this works. And so I think that's why it's so important to be clear about protecting, what we can. And of course, the other side of it is that the things that we have to do are things we should do for our health anyway. I mean, the air pollution stuff or the transportation stuff or the diet stuff, that all speaks to things we need to do for things like obesity, which is a huge challenge, mental health problems, heart disease. These are all things you would argue we should be doing anyways.
Let's go into those as a full topic, which is the idea of treatment as if the Earth is your patient, and preventative care. Those two kind of philosophies moving forward, and what action steps we can talk about specifically for the rise of obviously COVID, but what would be the next pandemic.
Yeah. So the prevention side is key, right? So let's deal with the economic part of it. So the cost of COVID to the healthcare system is going to be in the hundreds of billions of dollars. The economic costs are going to be around people are estimating $1.7 trillion for one infection. The entire budget at the CDC for dealing with like zoonotic, as these are called zoonotic diseases, right, is about $600 million. And our taxpayer dollars were, in my view, very wisely spent on a program that cost $200 million over 10 years to essentially detect these pathogens early and prevent them from spilling over to people. And that actually worked in several cases that, we prevented, the folks working on this prevented this. So, but there's been all these programs, which in some are, you're looking at like real money, which is like maybe $1 billion. But with this one infection, we're looking at hundreds of billions of dollars of just healthcare costs, not to mention the value of people who have died and gotten sick and all that other stuff. And very quickly, the economics show that the best thing to do is to invest in preventive measures, like looking for the viruses where they are, making sure that people who may be exposed to those viruses are protected, making sure we have the surveillance in place to make sure that if people do get infected, that they're cared, all the sort of obvious stuff. And then of course, how much does it cost to prevent deforestation, which is a major driver of this problem? Turns out that's like $100 to $150 billion proposition in the countries that really matter around the year, which sounds huge unless you're looking at a global bailout of, $5-7 trillion. So these are wildly cost-effective strategies. And of course, when you protect forests, you get lots of benefits, like you don't get the air pollution from burning them down that, like in Indonesia, killed 100,000 people a few years ago. So these are just wildly cost-effective things. And that's even true with like the Clean Air Act, which has returned 30 to 1. So that's just like on the strict like money side. But on the health side, so let's look at this. We spend about $2.5 trillion taking care of people when they've gotten sick in this country, okay? Depending on how you look at the pie, about half of that, maybe a little less, maybe a little more, is preventable. And the clearest example is that is obesity. So
Right.
when I started in this, like obesity was literally a rare disease. It was like a super unusual thing that like was the area of like a few people knew something about it, and like, and now it's like a third of the country's adults are obese. And I'm not that old, so this has happened in a radically short amount of time, and so that says two things. One is, we can undo this, and two, it's not our genes. Like it's not a genetic problem. It's like our food and diets. So what does it take to prevent obesity? Well, we know that people like me are actually pretty ineffective at doing it. Like coming to a doctor to deal with obesity is not that helpful. What is helpful is giving people access to healthy, nutritious food at a price they can afford that isn't processed and isn't meat, and giving them access to exercise, or at least routes to get to and from work and school that don't involve sitting in cars for hours at a time. Now, there's a whole deep discussion around like access to transportation here, and the fact that people who are less well off are being pushed away from cities because they're being priced out, and the fact that that means they're more dependent on cars, and the sort of how that essentially causes cycles of unhealth. But the reality is that the more we can use public transit, the more we can get active transit, the more we can give people plans to eat and less red meat, we're all going to be healthier. And oh, by the way, we're actually going to protect the climate. But frankly, we should be doing those other things anyway, because we spend a lot of time talking about that $2.5 trillion healthcare budget and who's going to pay. We're going to have one payer, we're going to have private payer. It doesn't matter at the end of the day if we have so many people who are so sick that they can't work. So, the preventive piece is a fantastic example of a huge win-win here. And frankly, we really don't have much of a choice. I mean, we have to do these things, and climate is another good reason to do them.
Right. And the truth is to that is that it's not even economically viable to just do treatment. Like when you look at from a pandemic standpoint, you can flatten the curve, but we don't have the public health infrastructure to take care of the people. Yeah. So we have to do this preventative health. That's really interesting. Do you have a kind of a thought on why, like when you look at the rise of the industrialization of processed foods and how that has become the cheapest option for people, and obviously that echoing kind of these obesity rates that, they're 30% maybe nationally, but some of these, states are above 55%. Do you have a thought process on an exit strategy for that?
Yeah, I do. And it's really great because we've seen progress in many places, and it requires changing how we do stuff. I mean, there are programs that are happening at schools, at private businesses, and really great stuff. So give you some examples. So
great.
People been working on obesity for a long time, and first we thought, okay, all we need to do is get people access to exercise programs. So there are all these programs saying, let's get people to like gym memberships and like exercise programs that are free and stuff like that. Well, exercising by yourself among people you don't know is not a great enticement. Getting people healthy food. So give people, I think over time we've recognized that people like to exercise as social groups. So we have all these programs now that marry, essentially walking, and we're not talking like, parkour courses here. We're these are like, walking things. Like, how do we get people walking together? How do we create spaces in cities and rural areas for people to walk? I mean, we're meant to walk. So the social aspect of it has really been powerful, and that's been true of adults and in schools. So like school districts, as you know, have like a dedicated bike to school day, and they sort of establish the mindset among kids that like, this is a viable way to go, and communities work to make that happen. You have walking school buses, you have all these things that are not the sort of, I mean, yes, it would be helpful to have PE and, that's a whole nother can of worms, because we've essentially eliminated physical education as if it was only good for kids' muscles and had nothing to do with their minds, which is crazy, but we can still work on that. But the bottom line is, the more we socialize that, physical activity is like what we do together, I think that's critical. The food side is even more compelling because, as you said, the cheapest, fastest food is incredibly processed. And it's cheap, frankly, because we're not paying for the fossil fuel damages in it. If we actually paid the true cost of that food, it would be wildly expensive. And then, of course, the problem is we're going to make people who don't have a lot of money to spend on food have a hard time buying food. So we've created this sort of gap here.
Right.
So here's some really clever ways around that. So in Boston, we have 2 stores operating right now that take advantage of the fact that the food labeling laws in the United States make 0 sense for a health or safety standpoint. Like, all these dates on a lot of goods are not based on health or nutritional content. They're simply out of thin air. Now, there are exceptions to that, but pretty much for canned goods and lots of other foods. So a lot of that food is we have this amazing food waste problem. We throw away like 40% of the food.
So much.
Mind-boggling. So that's a terrible loss in a number of ways. And so what can we do? Well, it turns out that people can buy that food at a fraction of the, initial market price, and you can cook it and put it into prepared meals and sell it at a fraction of the cost of prepared meals otherwise, because the food is just as nutritious and safe, but you're just not paying as much for it. And that provides access to essentially a healthy meal at a very low price. And that's happening in Boston right now. But in the same store, which is called Daily Table, they have cooking classes. And the cooking classes are not for the adults. They're for Boston school children, like my kids, who go there because the parents are working 3 jobs with no benefits. So are they really going to be expected to show up? We learned that, people know how to cook, essentially either what their parents told them or not at all. And so if you expect people, if you've never had a carrot in your refrigerator, figuring out how to make something with a carrot is not obvious. And so the kids learn how to do this stuff, and they go home and they help make this stuff. And that's great in any number of ways. And so in this one store, you see access to healthy, nutritious foods at a fraction of the price, with educational programs that essentially empower families. And you're dealing with food waste, which is a huge carbon problem. And like, the dividends are just like one upon the next upon the next. And that's just the tip of the iceberg. So when we integrate these programs, we have kids who have access to these programs, access to exercise. You see a real progress, but this shockingly requires like coordination and collaboration.
We're great at coordination. What are you talking about?
The truth is that we can deal with this. I just wish it were happening faster than it is.
Well, but that's happening, and that's not theoretical. Like, you're not pitching something that's not being done successfully is that just in Boston, or is that a nationally?
No, we're hoping it takes off. I mean, right now it actually got started. The whole idea, it's being run by Doug Rauch, who is the CEO of Trader Joe's, and he left Trader Joe's saying, "Wow, like he had a very, I think, clear insight into what was going on with food, and really wanted to make a difference." And so he got philanthropic backing to start these, and now he's essentially saying, "I want this to be a viable business. Like, I want this to be profitable." And so they have 2 stores now, and that the goal is to definitely make it a national program.
Asher, if you're on, we got to get on this. We'll make a phone call to this guy. This is
I'm on it. I'm trying to take the mute on here just in case my wonderful 4-year-old runs in here and starts screaming things.
The other thing that's really awesome is, and you may know Kelly Meyer's program around school. Of
course.
Artists. Yeah. So, talk about interventions that have so many dividends. 1, you get kids outside. 2, and exercising. 2, they realize that food is kind of precious. Like, the tomato may not grow the way it's supposed to, which means that it's probably good when you get that tomato not to throw it in the trash.
Yes.
And 3, it's a real opportunity to understand like what nutrition is really about. And so, you look around, and so many school districts have these programs, and the teachers who are like, talk about heroes right now. I think there are 2 heroes who are not getting credit right now. One is to the first question you said, Eric, which is parents. And two, our teachers. I mean, you know, talking about having to switch your livelihood on a dime, and all the hard work, and the fact that these programs largely are, you know, not funded. They don't get extra pay for this, and they're, you know, you have to plant a garden and do all that. So these are really, I think, powerful lessons that really benefit how children grow up in the world and think about food.
Yeah, we've had, just to jump in, we've had a school gardens program for a while.
Yeah.
And you know, it's amazing to see from the time when we open a school garden with one of our board members to like when you come and check in on it a year later, you know, how much the kids are excited about this as something that they're doing, you know, in their school day, how much ownership they have in the stuff that they've planted. And then the amazing experience of having them feed us, you know, a lunch, like we do like an annual lunch at one of these places, and then everybody sits down. And Eric, I don't know if you went, but
Sarah was there.
Sarah was there.
Yeah,
it's so awesome. They're like, this is the soup that we made with this thing, or this is the salad, and it's just so cool to see kids that are really attached to, you know, what they're growing and in the middle of the city, you know, which is it's very different than obviously if they had exposure to this forever.
Yes. I mean, that's it. Is that you talked about ownership, the ownership of the origin story of our proteins, of our plants and our carbohydrates. I mean, it's such a big thing. And when they go to the farm for the first time, we buy our broccoli from Kelly Meyer, which is amazing. But yeah, it's a really, and of course you're not taught to cook in school. So whatever you have is handed down from your parents. And you talk about the social economical divide. It's like, if I'm doing 3 jobs, I come home, I put some macaroni and cheese, processed food into the microwave, because that's all that I have the bandwidth to do. So that entry point into that conversation being so early is fantastic. And the fact that he's making it for profit, I think, I'm all for that. If you can balance out a way to do both, I think that's wonderful. What a win-win. One of my favorite comparisons when talking about climate change and the lack of ability to look at the science of that, and the comparison of secondhand smoke is so enlightening. It's such a great one. I will use that. Is if you look at COVID and our response based on the government that we have right now and leadership, it's almost like taking climate change and fast forwarding it and seeing how it unfolds. Do you want to speak to that at all?
Yeah, I mean, there's been a lot of people trying to map these two things out and sort of parallel and just say they're on sort of different time frames. You know, I think that the thing that's most remarkable to me is how you know, obviously it hasn't been marching in lockstep, but how most folks really got this, that we needed to change how we do business, and that was actually in everybody's best interest. And I mean, people doing huge sacrifice upon sacrifice to make that possible. And you know, health was the reason. I mean, people didn't want themselves to get sick. They didn't want people they cared about to get sick. And that just speaks to when we can help people grasp what is at stake for their health and the health of their children. You know, I've never met a parent when I've been taking care of a kid who even has like a run-of-the-mill ailment who doesn't think, what could I have done to have prevented this?
Right.
That is always on their mind. And there's always a sense of blame. Like, it's like, what did I do? And so, you know, I think about that in the context of climate change. If only we did a better job at bringing this down to size, which is, you know, and I talk in schools, how many people know a kid with asthma? And everyone's like, yeah.
Right.
And how many people have seen that kid have trouble breathing? And everybody raises their hand. How many think that's a good thing? Nobody raises their hand. I said, okay, well, what would you do? You know, what would you be willing to do to prevent that? Like, you know, everyone's like, you know, like, what can we do? And it's like, well, okay. It turns out that in the United States right now, 1 in 5 children have asthma because of tailpipe emissions, right? I mean, that's just the facts. and that's actually probably better. I mean, it's interesting, you know, air pollution has gotten a lot better, and other things about our lives have changed, and asthma has grown. So essentially the air pollution now is hitting a kid whose immune system is ready to be revved up, and that air pollution is driving them to get asthma. So, you know, there's so many things we can do to bring these issues to people in ways that motivate them. I mean, women who are pregnant, there are huge issues around air pollution. People who are who are at risk of dementia, huge concerns for air pollution. And these are not small numbers of people, as you know. And then, of course, the other thing is, like, would you like to avoid, having a heart attack? So I think the more we can personalize these messages and the more we can make it clear that these are not sacrifice. I mean, one thing, if we had to like lop off your arm to get to the good place, but that is just not true. I mean, it's just not true. The thing, and it's like reasons to be optimistic. The states with the highest penetration of renewable energy sources for their electricity are not California and not Washington State and not Texas. They are, wait for it, Kansas, Oklahoma, and Iowa, year after year.
I'm from Iowa.
There you go. So, and I'd like to think it's because they all want to save the planet, but that's not the reason they're doing it. They're doing it. It's totally economic. They have a lot of wind. I mean, that helps too. So, I think these arguments are absolutely what we need to do. And COVID makes it obvious. I mean, people are willing to change what they do if they see that it's going to benefit them. And so I just think, whether we're talking about child health, the health of people who are older than we are, I personally spend a lot of time thinking about the people in our communities who are less well off, because they tend to be on the short end of the stick in so many ways, and that what can we do for them? It's all right there sitting in front of us. So I think that's that in this, juxtaposition of these two crises happening is I think a really important thing for us to learn.
Well, let's, and maybe this is, I don't know, how much time do we have? No one's tripped in and
Don't I get to ask you questions now? Isn't that how this works?
Yeah, you can ask me anything you want. I'm an expert on a lot of things. But I think there's a good transition point here, to which is that, when we watch the TED Talk that Bill Gates gave, it's all theoretical, right? So many people are just like, yeah, and you're digesting it in a very different way to the reality that every single person is living on the planet right now. So theoretical becomes practical, and practical becomes, all right, what's the execution? What are the pivots moving out of this? What is the silver lining for this? There's smoke in the air. And you talked a little bit about this, but I wanted to, as much as we can get into a sound clip of like, what are the pivots post COVID-19 that we can make on an individual standpoint and also a global standpoint?
Yeah.
And I know you said some of these.
Well, no, I mean, I think to your first point, Eric, which is, they're the techno optimists, as I like to call it, the folks who go upon the, pretty good history that when we dig ourselves a hole, we dig ourselves out of it with some innovation.
Yep.
And frankly, the history of that too is we tend to dig bigger holes.
Yes.
And so one of my colleagues, David and friends, David Mendel, says, we're living on a technological limb of the tree of life, right? So we've sort of chopped off various limbs and we build a, synthetic thing to sort of plaster over that. And he said, we know the distance between the Earth and the moon down to a fraction of an inch. We know information about individual stocks, baseball players, and other, statistics to any number of decimal places. We don't know to the nearest order of magnitude, like 10, 100,000 million, how many species we share the planet with. And it's 2020. So, we have a track record of digging ourselves out of holes and innovating our way out of the holes we dig in. That's undeniable. But at the same time, the root of this problem is ultimately in like the planetary system of the climate and the life we share the planet with. And when we hack at that, we're hacking at something we don't really understand. By the way, COVID is showing us that. I mean, if we really understood what we were doing, would we really do this to ourselves? I don't think so.
No.
So that's our rub, right? So we can be optimistic about innovation, and I'll be the first to say we need some serious innovation here in ways that are happening, but in some ways that are distractions in my view. But just as we were talking about earlier with this idea of malpractice, if it turns out that we can't outsmart nature with our brains, we don't have another planet to go to. And so, we need innovation, but we also need to recognize what we have in our hands right now. And I think that's just the crucial point. If we were having this conversation 40 years ago, or remember the Carter administration, they wanted to do solar. It turns out solar was really expensive and really inefficient. It is not so expensive and not so inefficient today. And so I think the bird in the hand is really a wonderful thing. But, how do we pivot from COVID? I think the first major point is, it's at two levels, but is essentially we've got to vote. And whether that's voting in how we talk to our representatives right now about what the stimulus money is being spent on. I mean, you may know that there was a plan initially to take a huge amount of our money and give it to fossil fuel companies that were going under because no one wanted oil. Well, that's a very strange plan, because that actually doesn't help any worker. That helps the people running the oil companies. It does not help people in the oil companies very much. And as you are probably well aware, there are more people working in things like solar and wind in the United States than there are in things like coal.
Yep.
So fortunately, that some of that money is now going into actual small businesses and other places where people have jobs and so forth. But again, we could be putting in incentives with this money to get, industries to move towards renewables, to get public transit systems moving towards renewables. LA, I think, was probably the first city to say they're going full electric bus. That needs to be paired with full renewable energy, because if you're running that electric bus on a coal plant, it doesn't help much.
Right.
So, there are huge opportunities there. And then, frankly, we need to recognize that when we vote in our local elections, our state elections, and our federal elections, that what people do, as frankly pertains to in relation to science, like, do you think science is another belief system, or do you think that science actually helps us understand how the world works in ways that can benefit us, is a pretty important thing to understand about the person you're voting for.
Well said. Well said.
And then, on top of that is, what's the person's track record in terms of having people around them who know what they're talking about? I mean, if I want help with my plumbing, I am not a plumber. I can flood my house. I can make pipes burst. I can do all these things almost as well as anyone else on the planet. But I do not trust myself, and I don't trust my wife, and I'm sure she would be okay with me saying that. And I trust someone who's been a plumber for 30 years. Right. And I have great respect for that, because I know that actually requires some serious amount of skill, or an electrician. If I'm concerned about the health of people and climate change, I talk to people who've spent their careers looking at those issues. And if I'm interested in the solutions, I'm talking to folks like that. I'm not talking to politicians. I'm not talking to people who have just last week decided that they are the world experts on this. I'm talking to people who know what they're talking about. And, when with COVID, it sort of laid these things bare. It's like some quack, I'm sorry to say, says, oh, hydroxychloroquine, great idea. And then we have the president of the United States saying, let's do this. And then someone does a short trial, which has to be stopped because we're killing people with this drug. And oh, by the way, that drug is actually really useful to people who have diseases who really need it, right? This is reality. And I think that my hope is that in the pivot here, we can help people grasp that, like, science matters, that voting for people, that's a part of the equation, and that if a pandemic comes, you want people who are running the show who understand this, so that we're not, frankly, kept inside longer than we have to be, or that we're put inside too late, such that the disease winds up causing extra disease. And that's as true with COVID as it is with climate change.